This voiceover will cover the topic viral hepatitis. The liver is a powerhouse organ in the human body and is involved in many functions. Therefore, when the liver gets inflamed, it can have some serious consequences. Hepatitis is inflammation of the liver. Hepatitis comes in several forms. We will be focusing on viral hepatitis, but there's also hepatitis caused by alcohol, toxic hepatitis caused by medications and other chemicals, and there's two forms of autoimmune hepatitis that affect adolescent girls. They all, though, involve inflammation of the liver cells that impairs the liver's ability to function normally. Although we are not going to be talking about toxic hepatitis, I do want to point out that certain medications can cause hepatitis. Some very commonly used ones, including the statins for lowering cholesterol, anti-seizure medicines, and Tylenol, which used in excessive doses can cause liver damage. Viral hepatitis is a global health problem. As you can see from this infographic from the 2017 WHO World Hepatitis Day program, over 400 million people live with hepatitis, and 6 to 10 million people are newly infected annually. Our discussions are going to focus on viral hepatitis, types A, B, C, D, and E. These viruses are transmitted in one of two ways, either fecal-oral contamination or blood and body fluid exposures. Of the strains of hepatitis virus, hepatitis A and hepatitis E are transmitted via the fecal-oral route. One of the easy ways to remember this is that the vowels are transmitted via the fecal-oral route, and the consonant strains are transmitted via blood and bodily fluids. This F diagram is a reminder of how feces can transmit viruses to a new host via that fecal-oral route. Hepatitis B, hepatitis C, and hepatitis D are transmitted through blood and bodily fluids. On this slide is a table outlining those potentially infectious body fluids, as well as others that are non-infectious unless they are visibly contaminated with blood. Continuing our discussion of viral hepatitis, hepatitis can also be acute or chronic. So in an acute infection, this person is infected and then they recover, and that usually takes less than 6 months. If viral hepatitis lasts longer than 6 months, it's said to have gone into a chronic form, and that chronic form of hepatitis can span the client's entire lifetime. The chronic hepatitis also increases the client's risk for cirrhosis and liver cancer. In viral hepatitis, the client may present with flu-like symptoms. Other clinical manifestations include abdominal pain, irritability, pruritus, which means itching, and this itching occurs from the accumulation of bile salts in the skin. Other symptoms are fatigue, malaise, fever, nausea and vomiting, and jaundice. There will also be laboratory abnormalities, especially in the liver enzymes, which will be elevated. You have aspartate aminotransferase, AST, and then you also have alanine transaminase, which is also called alanine aminotransferase or ALT. Those are your two key elevated liver enzymes in viral hepatitis. As it progresses, you will also see an elevation in the total and direct bilirubin numbers, and this is where you'll see the clients becoming jaundiced. You'll have elevated serum ammonia levels. Ammonia is a waste product that is usually cleared by the liver, but if the liver is not functioning correctly, it will build up in the blood. You'll also have decreased albumin. The liver will not be able to function properly in processing fats, carbohydrates, and proteins. Other enzyme tests are listed on the screen. They might be elevated as well, although they can also elevate with other conditions, including cholecystitis. You also may notice dark urine, and this is from the bilirubin that's water soluble that is going to be filtered by the kidneys since the liver can't do it, and that will turn the urine darker. The clay-colored stool is a result of the liver not functioning to process the bilirubin, and as a result, the bilirubin is not in the stool to give it its typical brown color.
This slide has a table from your textbook on the manifestations of hepatitis and has the manifestations divided between those you see in acute hepatitis versus those you see in chronic hepatitis.
Now, symptoms of viral hepatitis can range from mild to severe depending on the individual. The most severe form of acute hepatitis would be fulminant hepatitis, which is a rapidly progressive, life-threatening form of acute liver failure that includes neurological decline, gastrointestinal bleeding, coagulation disorders, thrombocytopenia, fever, edema, and ascites. The encephalopathy or neurological decline will be due to that buildup of the ammonia waste product that can't be filtered. The gastrointestinal bleeding and coagulation disorders are a result of the liver not being able to do its job in synthesizing or removing clotting factors. Hepatitis A is the most common type of hepatitis and is primarily spread through the oral route from food, water, or shellfish that has been infected with the virus. Incubation is 15 to 50 days. There's only an acute form of hepatitis A, and treatment is symptomatic. Hepatitis B is spread by blood and body fluids or secretions such as semen. The virus can be spread through mucous membranes, contact with infected fluids, during childbirth, or through the puncture of a contaminated needle or other instrument. Hepatitis B does have both an acute and chronic form, and treatment of chronic hepatitis B can be done with antivirals and interferon. There are several different serological tests that can be done to check for hepatitis B infection. The basic test to check whether someone is infected or not is testing the hepatitis B surface antigen, the HBsAg. If it is negative, the patient does not have hepatitis B. If it is positive, the client does have hepatitis B, but we don't know whether it's in an acute or chronic form until further testing of the other antibodies are done. The form on your screen from the CDC goes into deeper detail if you are interested. Hepatitis C, previously known as non-A, non-B hepatitis, is spread through blood and body fluids similarly to hepatitis B. And it too exists in both an acute and chronic form. Unlike hepatitis B, there is no vaccine for hepatitis C. Treatment is with antivirals and interferon. Serological testing for hepatitis C checks for the HCV antibody. If there's no antibody detected, the patient does not have hepatitis C. If the test comes back with HCV antibody present, Further testing to check for hepatitis C RNA needs to be done to determine whether it is a current infection or not. In recent years, there's been a public awareness campaign in both print and broadcast media by the CDC to recommend to all baby boomers, those born between 1945 and 1965, to get tested for hepatitis C. Since hepatitis C in its acute form is often asymptomatic, these baby boomers might not know that they were infected years ago, in the days when medical equipment might not have been cleaned as well as it is, and the blood supply wasn't as screened as carefully as it is. Therefore, they could have a chronic hepatitis C infection that will only become noticeable when it has done substantial liver damage. By getting these baby boomers tested, they hope to intervene before the damage to the liver is done. Hepatitis D is not common in the United States and occurs only in people who are infected with the hepatitis B virus because it requires the hepatitis B antigen to replicate. It is transmitted in the same fashion as hepatitis B, only has an acute form, can be prevented by hepatitis B vaccination, and would be otherwise treated with antivirals and interferon. Hepatitis E is the second of the hepatitis viruses that can be transmitted via the fecal-oral route, primarily through water that is contaminated in areas of poor sanitation. It is not common in the United States. It only exists in an acute form. Treatment is symptomatic, and there is no vaccine. The management of hepatitis involves diagnostic test results and a thorough physical exam that are important in the determination of the cause of the patient's clinical manifestations. Most of the tests are collected as routine blood samples and require no specific preparation. FibroScan uses transient elastography to measure liver stiffness. A mechanical vibrating source is applied to the tissue externally, and the waves created are measured sort of like an ultrasound. And this can give the doctors a pretty accurate picture of the level of liver fibrosis. The gold standard for staging liver fibrosis is a liver biopsy. Approved therapeutic agents for use in patients with hepatitis include oral antiviral agents that aid in viral suppression, pegylated interferon injections that also work toward viral suppression, and vaccinations for hepatitis A and hepatitis B. If the liver becomes too damaged, a liver transplant might become necessary. Nursing care for the client with hepatitis will include vital signs and assessment especially for jaundice appearing in the skin or sclera. You'll also want to monitor intake and output and monitor daily weights. Promote a balance between physical activity and rest. Administer any antivirals as ordered and also any antiemetics, since nausea and vomiting are common with patients with hepatitis infections. You also want to provide small, frequent meals and supplements to support their nutritional status. In regards to hepatitis across the lifespan, babies born to hepatitis B positive moms should be given the first dose of the hepatitis B vaccine and hepatitis B immune globulin within 12 hours of birth to prevent transmission from mother to newborn. Children 5 to 14 are more likely to acquire acute hepatitis A infection. With children with hepatitis A infection, you want to encourage quiet activities for entertainment, and these children should not return to daycare until the virus is no longer detectable in the blood. Children with chronic Hepatitis B may be asymptomatic. Clients with chronic hepatitis C can develop cirrhosis 20 to 30 years after exposure, hence the concern with the baby boomers. Hepatitis C related cirrhosis is the most common reason for liver transplantation. And the chronic forms of hepatitis B and hepatitis C account for about 80% of all primary liver cancers. Vaccinations against hepatitis A and hepatitis B are available. Both vaccines are on the recommended schedule of vaccines for children. Hepatitis A immunization is recommended in adults for post-exposure protection. Hepatitis B vaccination is recommended for healthcare workers and anyone else who may be exposed to blood and bodily fluids in the course of their normal duties. There are several medications used in the treatment of the viral hepatitis strains. In regards to hepatitis B and hepatitis D, there are various antiviral medications, adefovir being the one you will be responsible for from Davis. The use of the interferons is a long-term, usually almost a year long. Interferon alpha 2B would be given several times a week. PEG interferon alpha 2A is only a weekly injection. Two medications that are approved for children with chronic hepatitis B include interferon alpha and lamivudine, both which inhibit replication and reduce the replication of the hepatitis B virus. For hepatitis C, the most common treatment is a combination therapy of PEG interferon alpha 2A and ribavirin. Client and family education would include the balance of rest and activity periods, decreasing risky behaviors that can contribute to transmission of these viral hepatitis strains, the use of good hand hygiene before and after meals, and use of the bathroom to decrease the transmission from the fecal-oral route. Vaccinations. Clients with hepatitis B and C should not donate blood because of the chronic forms of the disease. Clients with hepatitis should not share personal items with others, especially objects like razors and toothbrushes. You want to attend to safe water and sewage management, and the client and family would also need nutritional teaching.